How are you today, Anna?
I'm good. How are you?
Good, good.
Yeah, so it's so good to see you again.
You too.
Um, and I mean, I just want to start with, of course, if anybody is new here, just kind of like introduce yourself and like your pronouns and what you do.
Yeah, of course. So, hi everybody. My name is, I'm trying to put my phone in a place where everybody can see me. My name is Suzanne, and I use she, her pronouns. I'm one of the health promotion specialists at our health promotion office in College Station at A&M.
Yeah,
Yep.
and I just want to introduce myself for the people who are not there. I completely forgot about that. But my name is Anna, and I'm a student worker at the Pride Center. And today we're going to go ahead and talk about PrEP and just kind of like prevention. And
Yeah.
first, we just want to start by asking what is PrEP?
Yeah, so PrEP is actually an acronym. It stands for pre-exposure prophylaxis, and it's actually a prescription medication that folks can take daily to actually lower their chances of getting HIV. So you might have like seen commercials maybe for a medicine called Truvada. That's what it is. It's one of the FDA approved brands of PrEP that's available. And what it does, it actually works in your body to prevent the HIV, the virus itself, from replicating inside your body, thereby preventing you from getting an HIV infection.
Yeah, and I mean, I want to ask like how common is like HIV and the LGBTQ community and like
Yeah, I think there's kind of this perception that it's just for the LGBT community, or only members of that community can get HIV, which is not true. Unfortunately, the data does say that members of the LGBTQ plus community are at a disproportionately higher rate of, or disproportionately more likely to get HIV. And more than half of all new cases each year are gay and bisexual men. But like I said, this anyone can get HIV, and so if we have that kind of attitude that like, oh, well, I'm not gay, so I can't get HIV, that's harmful to members of the LGBTQ plus community, but it's also harmful to those people who have that attitude, because that means that maybe you're not taking the safety steps that you need to.
and just real quick, HIV is the human immunodeficiency virus for those who don't know.
Yes, good point. Yeah, it is an acronym, lots of acronyms sometimes when we talk about STIs. Good catch.
So my next question is just if somebody were to take PrEP, does that mean that they can stop using condoms, or do they still have to use protection like when having sex or intercourse?
Yeah, so no, don't stop using condoms just because you start taking PrEP. So PrEP is for anybody who is at risk for potentially contracting HIV. And so something you can talk about with your doctor. But just because you're taking PrEP doesn't mean that you shouldn't use condoms or other barrier methods when you're engaging in sexual activity. Because while PrEP can prevent you from getting an HIV infection, it does not protect you from other STIs like chlamydia or gonorrhea or any other kind of sexually transmitted infection. And so that's why regular testing and using condoms, using dental dams are going to still be really great measures to protect yourself, not only from HIV, but from those concerns as well.
Yeah, and that kind of leads to my next question. Well, I mean, I know like in the LGBTQ community, there's a vast amount of people. And so specifically, if somebody is transgender, will PrEP interfere with like their hormone therapy, or how would that work?
So, well, I forgot to mention earlier that the transgender or trans women are at a slightly higher risk as well for HIV, especially if they're having sex with men. But that aside, so far, research shows that that PrEP should not interfere with hormone therapy or hormone affirming or gender affirming hormone therapy. And while more research probably needs to be done on that right now, there, like I said, there's not really evidence to support that it interferes at all. Anybody who's taking PrEP is going to be seeing their healthcare provider on a regular basis, like probably about every 3 months, just to check up, do follow up, get tested, and then, you know, refill that prescription as they need to. And so a trans person might consider combining that with their hormone therapy appointments to put it all in one and make life a little bit easier and keep themselves safe still.
Yeah, for sure. So, I mean, that's really important, just kind of like getting tested and everything.
Yes.
So that, I mean, does that mean like, you know, can you start PrEP after you've been exposed to HIV? Like, how would you know, like, you know, if you needed to start PrEP?
So well, first of all, you'd want to talk to your doctor about it. And there's actually some really great, and I know we'll talk about this in a little while too, but there's some really great resources out there about how to talk to your doctor about PrEP and whether it's something that you should go on. And it is, like I said earlier, pre-exposure prophylaxis. So it's not, so if somebody is concerned that they have been exposed to HIV, they would need to see their healthcare provider. And there's another medicine called PEP, or post-exposure prophylaxis. So if somebody has been exposed to HIV, then that would be the medication they take. But it's about a most of it is about a 28-day regimen to take care of that potential exposure. But PrEP, again, is for someone who hasn't been exposed to HIV, and it's actually something that you take every day for a long period of time.
Yeah. And I mean, going off of that, like, how can somebody prevent HIV?
Yeah, that's a great question. So, I mean, like we've been talking about, PrEP is a great option to prevent HIV infection. But there's plenty of other things that we can do to lessen our chances of getting HIV or any other STI. Number one is to use condoms, dental dams, and lube, especially depending on the type of sexual activity you're engaging in. Lube is always going to be a good idea. Makes things more comfortable, but also can increase the efficacy of the condom itself, and lessen any chance of like tears in the tissues and anything like that, which can actually lessen your likelihood of getting any kind of STI, especially HIV. And then, of course, we want to get tested regularly. We talked about that a lot last week. But that's the only way to know if you or any of your partners has HIV or any other STI. And then we want to make sure that we treat STIs. So if you do get tested and you do come back positive for an STI, we want to make sure we get those treated, because when we have especially untreated STIs, some of those can actually increase our risk for getting HIV. It makes it easier for that virus to get into our bodies and be there. So of course we want to get tested, treat it, and make sure that our partners do that as well, which leads to the next way to prevent HIV, which is to talk to your partners. Communication is part of every healthy relationship, but not only talk to them about y'all's HIV status, but also discussing other ways that you want to take together to protect each other from HIV and other STIs, and get tested together and things like that.
Yeah. And is HIV something that like people can live with, throughout their whole lives, or like, what is it?
Yeah, so a lot of people, there's, I think, a stigma that if you get HIV, like you're gonna get AIDS and it's gonna be terrible and that's the end of everything, and that's not true. There's, especially if you know you have HIV, if you get a positive test and you work with a healthcare provider to treat it, you can actually live a very long, normal, healthy life. So there's treatment for HIV infection, because not every HIV infection is going to lead to AIDS. Some of them do, but even then there's always still treatment. And so that's why prevention is super important. But then regular testing is really important as well. So that way, if, like I've been saying, like you can treat things and get better and go about your life.
Yeah,
Have a
and
good time.
yeah, for sure. I know it's very important, especially like right now, like, to be safe about that kind of stuff.
Exactly.
Um, so, I mean, lastly, I mean, that's my last question just would be like, where can people find resources about PrEP and like just prevention and things like that?
Yeah. So the CDC website actually has a ton of really great information about PrEP and PEP. And I think I mentioned earlier, like they actually have a document that you can look at that kind of helps you like walk through that conversation with your doctor or your healthcare provider about wanting to go on PrEP and starting that up. The Human Rights Campaign website also has some really great resources and information that I found. And so for folks who are in College Station or Bryan, the Student Health Center at Butyl is available to A&M students, and you can actually talk to a provider there about getting on PrEP, and they can prescribe it for you, and you can get it filled at the pharmacy at Butyl. But if you're not a student or if you don't feel like going to the Student Health Center, Brazos County Health District also has their sexual health clinic. You can get on PrEP there, or before you do that, obviously you would talk to somebody, one of their clinicians, about PrEP and whether that's something that would work for you.
Yeah, well, I mean, thank you so much. This has been super helpful information.
Yeah, you're welcome.
Yeah,
It's really important to talk about PrEP because it's for anybody. It doesn't have to be for it doesn't have to be just for our friends in the LGBTQ plus community, but it's a good thing for everybody to go on because, like I said, everybody is at potential risk for getting it. So I
yeah,
want
for
to keep
sure.
everybody safe.
Yes.
You're welcome, Britt, the best, for the information.
Yeah. So we will be doing these segments every Thursday this October. So tune in for that. I will be posting up something on Monday regarding the next topic. But thank you so much for being here today, Suzanne.
You're welcome. You're so welcome. And if anybody has questions, feel free to message Health Promotion or the Pride Center, and we will find you some more information and answers.
All right. Well, thank you so much. If you just want to give a small shout out to your social media so that way people can follow.
Sure. Yeah, we're at Tamu Health Promotion here on Instagram, and I don't actually remember our Twitter handle, but we have one. So if you're a Twitter person, you can Google or look on Twitter, not Google, Tamu Health Promotion, and it's probably very similar. But if you're seeing this, you're probably on Instagram, so give us a follow.
All right. Well, thank you so much, and I'll see you next week.
You're welcome. Bye, Anna. Have a great week.
Bye.